So it's like something which I decided, and I was given like this particular topic because we have been discussing about diabetes since like morning, and this is like whatever we are indicated, be it glucose monitoring, be it CGM, be it an SMBG, whatever we do, or be it a simple diet or maybe an exercise, whatever we are asked to do as a patient, we need to have a mental bent towards. So if we are not having that, like synchronization between our allowance or between our indulgence towards that, none of the, I mean, whatever is required to be, I mean, in a better living condition with the disease, maybe a type 1, type 2, GDM, whatever. So if our synchronization with the mental health and wellness is not happening, finally we end up nowhere. So thank you for this topic. As I got it, maybe I have very little to, make you understand, because I'm not a psychiatrist, neither a psychologist, but whatever in my, I mean, meager terms I have understood, I'm trying to explain on that. So it's a mental health, and like it's a mental health which we'll be discussing, and my table of contents will be introduction, of course, to diabetes and mental health, the mental health challenges in diabetes, mechanisms linking mental health, screening and diagnosis, and management treatment strategies. I would be discussing some of the case studies, very minimum maybe, but I'll be discussing, and then the culture and the demographic consideration, challenges and future directions, and the conclusion. Next, I have divided my presentation, my talk, into different sections, as I have told you. So the first part, I will be introducing the diabetes and the mental health. So this is, as we all know, that we have been discussing that the different types of diabetes, and as per the statistics, we get an overview that 463 million people worldwide live with diabetes, according to International Diabetic Federation. So it is like it's extremely crucial for us to understand that how difficult the condition is as of now. And another thing is that 1 in 11 adults have diabetes. This is as per as WHO 2019 guidelines. So, and then like what exactly is the, the mental health, and how do we actually refer to it? So mental health refers to a person's, I'm so sorry. So sorry. Why I'm getting, I'm so sorry. So just a minute. So yeah. So the mental health refers to a person's actually the emotional, psychological, and social well-being. So how I mean, behave, and how it is being regulated. How do I mean, interact? Everything is a part of my emotional regulation, and that is also a part of my mental health. Thought processes, my negative thoughts, maybe my positive thoughts, my being constructive. So these are my thought processes, which are also a part of my mental health. Now, my behavioral responses: do I behave rude? Do I behave polite? Do I am open minded? Or maybe at times I'm close ended. So everything is a part of my being into the positive mental health. And the relationships and social interactions also to some extent depend on my being into the proper mental state. So now I will just try to be into certain key mental health conditions, like first of all, the depression, anxiety, and stress. These three are extremely important to know once we get into this mental health issues. So depression is nothing but a state disorder, we can say, where we feel sad and hopeless. So, and we basically don't get interest in any of the thing, and also no pleasure out of any happenings. So, and especially it is for diabetic patients, it can manifest with additional physical symptoms like low energy levels and reduced motivation to adhere to the diabetic care routine. That is most important. If the diabetes if a particular diabetic patient is not adhering to the, I mean, routine he's supposed to or she's supposed to take care, then there lies the problem. And that creates an added anxiety, not to the patient himself or herself, the entire family members, because like that, with the excessive persistent worry, maybe the he's not being able to maintain the glycemic control, and there are episodes of spikes, and that there are episodes of hypoglycemia. So these are being created with the depression, because he or she is not adhering to what he's supposed to do, and instead he gets into a lot of stress, and which is a part of the natural response. And at times he's threatened, and he's not being able to overcome. At times he's feeling low on energy, because these are all related issues. And so this is a very important three part of the mental health conditions, and we of course need to understand what exactly it is. And now this the global impact of mental health disorders. So this is data which is there in WHO, that over 300 million people globally experience depression, and 264 million suffer from anxiety disorders. And this is something, I mean, a very alarming a condition where like, and this is for the chronic illnesses. For instance, research shows that around 20 to 30% of people with diabetes are likely to experience depressive symptoms, which is nearly twice as high as in the general population. So we need to be extremely cautious at this condition. So this estimates 40% or more also may experience some form of anxiety, including general anxiety. It could be a social anxiety, or maybe like a specific fear for something, like maybe a fear of hypoglycemia, maybe a fear of getting into some, I mean, comments like in what injections, maybe for the type 1 people, like by type 1 patients, that what type of injections is it, is he going to contaminate others? So people are not always knowing that, maybe we are feeling embarrassed, we are not discussing the cause that we are diabetic. So several issues are creeping in, and that creates an unnecessary anxiety, stress, and cause of that leads to not adherence to the quality of life he or she can do it with a proper regimen. So impact on chronic illness, this actually impacts the entire population, that diabetes are at a higher risk of developing mental health issues due to demanding nature of managing their disease. So this is also very, very important. And like the mental health in quality of the life and disease management is also equally to be understood, that this mental health significantly impacts the quality of life, because the emotional well-being, social relationship, and the daily functioning. I mean, small thing, that getting up in the morning, like taking care of own self, the daily routine, the so those things are often being neglected, and the patient often feel like low on energy to take care of even the medicines that before breakfast he at times or she at times forgets, and don't feel like apathetic towards that, I mean, taking of the usual doses, and even they do not follow the proper guidelines of eating, because the one who is understood how to have the disease, he had previously also, maybe he's diagnosed, and he is into he is with the doctors, consulting doctors, taking medicines according to the regime, but suddenly with the development of this depressive conditions, he might get into certain adversities which will, I mean, not help him to follow the usual routine. So this is this also the same thing which is there. And so there is a strong connection between diabetes and mental health. So diabetes is not just about blood sugar control, it's about emotional resilience. So that we have to understand. And living with diabetes can be emotionally challenging. Understanding the connection between diabetes and mental health can really help. So here we'll come up with the mental health challenges in diabetes. So these are the common mental health conditions which is often faced by the diabetic patients, like diabetes distress, which refers to the negative emotions and burden of self-management related to living with diabetes. And there is also another very common condition where the psychological insulin resistance is seen, and this is a particular reluctance or refusal to initiate the insulin therapy, where the patient is not ready to accept that he or she has got like certain symptoms or signs, and he or she need to initiate with the insulin. So, and there is also another typical like this condition of fear of hypoglycemia in which is very common and in diabetes specific, and it is very common in ruling as a mental health condition. So other conditions which are seen in adults are major depressive disorder, bipolar disorder, schizophrenia spectrum disorders, personality traits disorder, stress, trauma, abuse and neglect, which is already being discussed, and anxiety, feeding and eating disorders, and sleep walk disorders. So at times there are patients who in the fear of hypoglycemia start getting into, many of the type 1 patients are seen to often get into binge eating, eating beyond the carb counting, like huge portions of carb to avoid which to avoid hypoglycemia, and in totality they face a lot of fatigue and even episodes of lot of spikes in between. So even some patients are seen to get into alcohol, smoking, and substance use disorder. So these are often seen to as common mental health conditions, and the link between mental health and diabetes has to be understood. So interconnections of mental health and diabetes which has to be restored, and this, once we are connected with that, so increased risk of mental health issues could be discussed, and individuals with diabetes are more susceptible, as we already know, and those challenges like depression and anxiety need to be corrected and checked. So prevalence of depression in diabetes is also very common, and approximately 1 in 3 people with diabetes exhibit symptoms of depression according to WHO, so which is very alarming. Now, complications in diabetes management even increases comorbidities once there is self reluctance, self negligence. So the comorbidities naturally will creep in faster, and that will even that. So the final look out over this thing is that the integrated care should be there. So the relationship underscores the need for integrated care approaches. So not a single doctor or not a single dietitian could actually do it. So it's a combined effort or a combination of the doctors, the life skill counselors, the diabetes educators to actually, and psychologists, psychiatrists required with their therapies and their medicines to interrelate with the patients ongoing with the disease, and at present that has to be initiated. So the bidirectional influence of diabetes and mental health is very important, and mental health issues can worsen as we are constantly discussing. That will actually worsen the glycemic control, and poor diabetes management can aggravate the mental health conditions, and depressed patients may neglect diabetes care. So they might not turn up to the doctors, they might not miss, they will not go to the dietitians, they will feel reluctant, they will not take care as it is required. So, the psychological impact of the diabetes diagnosis, initial stages, there will be fear, denial, anxiety, and even anger. So these are definitely being seen, and they gradually they need to be, with some care and management so that they can cope up with this chronic disease. And social and lifestyle adjustments are must because they are modifiable, and diet, exercise, family support is very well required because they need to identify that the patient is having some inclinations, they are having some depression, anxiety, stresses. So the family members are the best to help them out at this condition. And then the mechanisms linking mental health and diabetes, a lot of mechanisms are there: impact of cortisol and stress hormones on blood sugar regulation, inflammation at times, and then the dysregulation of neurotransmitters, effects of serotonin and dopamine. Also this also creates this like mental health conditions to aggravate. And behavioral mechanisms like mental health impacts behaviors, the reduced motivation for exercise, and this all consequences
Anvi,
they often
Anvi,
skip
the document is not
medications.
opening when I download it.
uh,
Ma'am, you
You
kindly
have to resend me. It's
yeah.
coming like
ma'am,
a doc something,
mute
uh,
not as a
yourself.
uh,
PPT.
uh,
Sonal, ma'am, can you kindly mute yourself?
uh, Consequence, I'm sorry, I should be continuing. Consequences that this leads to skipping medications and at times ignoring the blood glucose monitoring. So the social determinants of health is also, there's stigma. The diabetes and the mental health issues are, they can carry social stigma, and they often, they this affect their willingness to seek help. They're embarrassed and they don't feel like that they are in trouble. So for that reason, they avoid the situations which can, even make them get not get into surface. They are being trying to avoid certain social gatherings, and there's this, a total different feeling where they try to hide, not maybe with their physical cause that they are diabetic, but with the mental state of health. So screening and diagnosis, that is very important. So the screening is essential. Early detection allows for prompt intervention, because unless until it is detected, the intervention is never possible. So we have several tools like patient health questionnaire 9 in a scale. This is a item 9 where it is being scaled accordingly, and these are tools, and which are used to, quantify, their state of depression, their state of anxiety. And this is also an anxiety, generalized anxiety disorder. This is the scale of 7 for anxiety, and this on scoring of this particular thing, we can understand that what state of health, mental health, they are at present in. So diabetes distress scale is often, these are the questions which are targeted, which are related to the diabetes management, and frequency and thresholds to determine if additional support is required. And then immediately there should be a synchronization between all the healthcare givers. And for if they are synchronizing well, they are talking to each other, and they are prescribing some low dose, medicines which are antidepressants, or maybe anxiolytic drugs. So that can really, really help the patient. So management and treatment strategies. So integrated care approach, as I have been already been discussing, that involving the endocrinologist, mental health specialist, and dietitian. So it should be, like a good group of healthcare people who should be ultimately offering their care and help towards the patient. So lifestyle interventions, of course, it's a must. Nutrition, exercise, sleep, hygiene. So once introduced regular physical activity and a balanced diet, it is seen to improve. And maybe some of the people enjoy doing, they will be able to divert their depression, anxiety, stress. And it is already been proven that how beautifully even some people can get into dance, or maybe yoga, or maybe some sort of exercise, and they will divert their agonies and their negative feeling and burden over their disease. And this all this thing will really improves. So psychological interventions is also very, very important part. This is especially devised to, turn their negativity into some mindfulness. So some soulful music, or maybe the understanding, the psychological understanding of their negativity in the mind will be even gone away with this CBT, that is a cognitive behavioral therapy, and that reduces the stresses and makes the person mindful. So medication, of course, is very, very important. And patient education and empowerment is most important, because the education of self-management is the key. The techniques, the the patient should be motivated, not disregarded. So, and that is only possible for, honestly, it is possible for the diabetes educator to get into and venture into this particular idea. We should give time to the patient to understand where it is going wrong. Why are they not being able to, keep up to their glycemic control? So we need to give them time and our energy, and we need to be empathetic towards them, to, with motivation, with kindness, with, with all our attitude, that yes, we are good listeners, and we are trying to understand and locate the trouble of their difficulty. And of course, we should teach them properly how to self monitor. And then the case studies. So I just will be quickly go through the case studies. I have only two case studies which I'll discuss. Shimanti, do I have time, or I cannot see the clock? So am I going?
Ma'am, little more time. We
Have
have
one. You
one
have
minute.
one.
Okay, okay. So this patient, she was diagnosed with type 2 diabetes, and she a long time back, and but recently, like her family members could see that she's not, getting into a lot of routine activity, and she's performing really in a certain, which was not expected to her to do it before. So, and the lab results will also, this lab results have also seen that they have she has or got her elevation in this glycated hemoglobin, and which indicated that suboptimal glucose control over the past few months. So why is the reason? What is the reason? This is nothing but, the mental well-being is lost somewhere. So intervention required. And so again, the that totality in the multidisciplinary approach, the endocrinologist along with the psychiatrist, the psychologist, and the life skill, the physiotherapist, the dietitian, they all came together. Now this lady was lucky enough because she could afford, but in minimum cases where patients cannot afford, then also if a diabetes educator is mindful and soulful, she can also change it. I tell you, even in my clinic, when I see patients, I try to like my who is there with me, both of us try to be mindful enough and give time to the patients to listen to them properly. Maybe not together so many, maybe he or he, if they cannot afford, but of course, even the diabetes educator, the dietitians, they should be having some time, and they should discuss with the issues well. And this outcome has really really have done miracle to this patient. And 6 months, after 6 months, it was noted, like maybe more than 6 months, I believe it was seen that it was like the control over the HbA1c has improved, and the patient was really not even like, not absolutely was going without spikes or something, but yes, she was performing better. And that is, I mean, truth behind the intervention strategy when it happened in a combination with therapist. So, and the case two is discussing about the same thing, but with type 1 patient who used to have a lot of carb eating, getting into an idea that maybe he will have, hypoglycemia. And in course of that, he used to have a lot of anxiety and, stresses and all these things. Again, got into some psychologist intervention, CBT, and the negative were being, taken care. And ultimately, both of the cases, the outcome and the key insights are the patient reported fewer panic episodes and better glycemic control. So that's what is intended, like with this talk, that nothing could be done. No, I mean, nothing. If the mental state of a person, of maybe a diabetes patient with diabetes, or maybe a normal person, if the mental well-being is not there, it is upsetting. No matter what is the requirement, he or she will not be able to fulfill. So the screening and the intervention is very important. And for especially for the diabetes patients, it's a must, because unless and until they are into a lifestyle management, the causes won't be taken care properly. So this is the just a review which I'm not going to get into. And the cultural and the demographic consideration is very very important, which already I have discussed. And just gender differences, challenges for older adults and challenges for young adults. These are certain points which I've kept in mind. And even during pregnancy, the GDM patients, they have to be taken care, because they're during pregnancy, a lot of other things, the hormonal impact is there. So a lot of body changes, so physiological differences happen. So there also the patient need to be, the patient, the husband, the family member, everyone need to be empathic, and the patient need to be dealt up properly, not with the, I mean, not with a hurry, not with some rude gesture. Person need to be polite and caring, so that he or she can be taken care of. So challenges and future directions, of course, the challenges in management, and there are technological advancement, as before me Anindita Di has described, and so many other speakers, they have, I mean, wonderfully said, and how important is the technological advances going on. So it will be almost in the fingertip in near future, and already it is now, the telehealth and mobile apps. So they all will help us to just a call that, yes, I'm having certain problem, I'm having some like I am not being able to comprehend, I'm not being able to understand, I'm trying to segregate me out from all. So future directions are also indicated, that a lot of studies are there which are showing the gut and the brain axis, and the this is are very very important. And advocacy for finding integrated mental health diabetes research is also indicated. Now, this future directions, just the same thing. I have tried to, ornament it a bit. So, understanding mental and health diabetes. Now, there are longitudinal studies across how mental health affects diabetes outcome, and over time will provide valuable insights. We are all hopeful, and intervention trials are already there, and technological innovations, which I've already discussed. And finally, the conclusion. So, to summarize, diabetes and mental health are closely related, and they're presenting unique challenges of their own. One is physical and the other one is mental. So they are, in the way, they are actually, both are very important and both need to be catered well to get like a relief from each. So effective care requires a multifaceted approach. A psychoeducation, very important, self management, psychological support, and integrated care, and finally the medications, which we should never go away from. And integrated personalized care is crucial for addressing both diabetes and mental health needs effectively, and there should be a simultaneous management of diabetes and mental health, which can significantly enhance quality of life for affected individuals. So with this, I think I should be ending, and thank you all for giving me this time and opportunity and patient listening. Thank you so much.